Do you know what this is? This is the thyroid gland. It is an endocrine gland which appears as two lobes symmetrical in size and shape, located on either side of the trachea, just caudal to the larynx. The thyroid gland is very important as it produces thyroid hormones thyroxine, T4, and triiodothyronine, T3, which are responsible in the regulation of many body functions, such as heat metabolism, cardiovascular stimulation, gastrointestinal regulation, bone and tissue growth and development, central nervous system activity, and regulation of carbohydrate, lipid, and protein metabolism. Thyroid hormone secretion is regulated primarily via feedback control mechanisms through the coordinated response of the hypothalamic pituitary thyroid axis. Decreased levels of thyroid hormones result in secretion of thyrotropin-releasing hormone, TRH, from the hypothalamus, which binds to the thyroid trough cell in the anterior pituitary gland and stimulates secretion of thyroid-stimulating hormone, TSH, which then will stimulate the thyroid for hormone synthesis and secretion. Conversely, when the levels of thyroid hormones T4 and T3 increase, the negative feedback will prevent the release of both TRH from the hypothalamus and TSH from the anterior pituitary gland, thus regulating the hormonal output from the thyroid gland. These feedback control mechanisms allow the body to maintain an appropriate level of thyroid hormones in the body. However, this mechanism can be disturbed by several factors, thus leading to abnormalities in the hormonal output of the thyroid gland, in which there can be too much or too little. This is known as hyperthyroidism and hypothyroidism. Hypothyroidism is a condition in which the thyroid gland is not able to produce and secrete enough thyroid hormones as the body needs. It is a common multisystemic disease in middle-aged and older dogs, predominantly in breeds such as Cocker Spaniel, Golden Retriever, and Doberman Pinscher. There are 3 types of hypothyroidism, classified based on their causes. Primary hypothyroidism is decreased thyroid hormone production and secretion due to thyroid gland destruction caused by conditions such as lymphocytic thyroiditis, which is an immune-mediated destruction whereby there is lymphocytic infiltrations in the thyroid gland. Next is idiopathic thyroid gland atrophy, which can lead to replacement of thyroid parenchyma by adipose tissue, and also other causes such as uncommon congenital conditions like thyroid dysgenesis and also the after effects of thyroidectomy. Secondary hypothyroidism is decreased thyroid hormone production and secretion due to a deficit in thyroid-stimulating hormone, generally due to lesions affecting the pituitary gland such as tumors, which can destroy normal pituitary thyroid by neoplastic tissue invasion. And lastly, tertiary hypothyroidism is decreased thyroid hormone production due to a deficiency of thyrotropin-releasing hormone caused by lesions affecting the hypothalamus. So, what can we see when an animal is suffering from hypothyroidism? Well, effects of thyroid hormone deficiency can manifest in decreased metabolic rate, which presents as lethargy or dull mentation, exercise intolerance, weight gain without increased appetite, and cold intolerance. It also manifests in integumentary changes such as dry, dull hair coat, bilateral symmetrical truncal alopecia, cutaneous hyperpigmentation, excessive shedding and retarded hair growth, and myxedema, the thickening of the skin. In laboratory findings, complete blood count revealed mild normocytic, normochromic, non-regenerative anemia. This is due to factors such as reduced metabolic rate, decreased tissue oxygen requirement, and decreased erythropoietin production. Now, in a serum biochemistry analysis, the main parameter noted is hypercholesterolemia, which is found in 75% of cases. Lipid breakdown is decreased in hypothyroid state, so fat accumulation may occur in the circulation. Occasionally, mild changes in liver and muscle-related enzymes may be found, For instance, there might be an increase in creatine kinase indicating myopathy. Also, mild to moderate increase in alanine transaminase and alkaline phosphatase, which occurs due to hepatic lipid deposition. As for the diagnosis, hypothyroidism can be indicated through the evaluation of basal total thyroid hormone concentration, which will demonstrate decreased serum T4. Other than that, there are two tests that can be done, which are the TSH and TRH stimulation test. As for TSH stimulation test, firstly, blood collection is done prior to hormone administration to measure the baseline serum T4 level. Then, 100 microgram of TSH is administered intravenously. After that, blood collection is done 4 hours post-administration for the measurement of serum T4 level. If the result of the TSH stimulation test shows failure of serum T4 level to increase, it indicates primary hypothyroidism, whereby there could be lesions affecting the thyroid gland, while the increase of serum T4 indicates secondary hypothyroidism. As for the TRH stimulation test protocol, firstly, blood collection is done prior to hormone administration to measure the baseline serum T4 level. Then, it is followed by an intravenous administration of 0.1 milligrams per kilogram of body weight of TRH. After that, blood collection is done 4 hours post-administration for the measurement of serum T4 level. If the serum T4 failed to increase, hypothyroidism can be indicated. In conclusion, a low serum T4 concentration, hypercholesterolemia, and clinical signs can be strongly suggestive to establish the diagnosis of hypothyroidism. Next, hyperthyroidism is a condition where there is an excessive circulating concentration of thyroid hormone. This is more common in middle-aged to older cats. The most common cause of hyperthyroidism is adenomatous hyperplasia, which involves the enlargement of one or both lobes of the thyroid gland, causing high circulating concentration of thyroxine and triiodothyronine. Other causes include thyroid carcinoma and thyroiditis. So, what can we see when an animal is suffering from hyperthyroidism? Generally, there is weight loss but increase in appetite, palpable thyroid gland enlargement, unkempt and matted hair coat, and polyuria polydipsia. Hyperthyroidism also affects the gastrointestinal, cardiovascular, and respiratory systems. Clinical signs include vomiting, diarrhea, and increased defecation frequency, systolic murmur and increased heart rate, dyspnea, and increased respiratory rate. Now, let us move on to the laboratory findings. From a CBC, findings include mild erythrocytosis due to increased production of erythropoietin, secondary to increased consumption of oxygen. We can also see elevated mean corpuscular volume and a slight elevation in packed cell volume, most probably due to dehydration. We can also observe leukocytosis and eosinopenia. From a serum biochemistry analysis, findings include increased liver enzymes like ALT, AST, and ALP, either singly or in combination due to toxic effect of the thyroid hormone, which causes depletion of mitochondrial activity with subsequent apoptosis of hepatocytes. Now, how to actually test for hypothyroidism? Well, it is known as the basal thyroid hormone concentration test, where confirmation is achieved by demonstrating increased production of thyroid hormones. Other tests include the triiodothyronine suppression test and TRH stimulation test. As for triiodothyronine suppression test, patient will be administered with triiodothyronine or T3. As a response, in normal patients, there will be a decrease in thyroid hormone. However, in patients with hyperthyroidism, there will be a persistent level of thyroid hormone. As for TRH stimulation test, a blood sample is obtained for baseline serum T4. Then, TRH is administered and second blood sampling is obtained after 4 hours. If serum T4 levels increase 50% over the baseline, hyperthyroidism can be indicated. In conclusion, a high serum T4 concentration palpable thyroid gland, and clinical signs can be strongly suggestive to establish the diagnosis of hypothyroidism. That's all from us. Thanks for watching.